A 42-year-old man presents to the ER for alcohol toxicity. While taking the history, the nurse discovers that he drinks on average 1/5 of vodka per night, and often must drink an additional 6 to 12 ounces to get a good buzz. When he doesn't drink, he experiences tremors and feels unwell until he is able to drink again. When asked if he would like to quit drinking, he states that he has tried unsuccessfully several times over his life. He knows that he needs to get control over his drinking because it is seriously impairing his relationship with his husband and their 13-year-old daughter. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, this patient can be considered to have which of the following conditions? A. Substance dependency. B. Substance addiction. C. Substance abuse. D. None of these. The answer is A. Substance dependency. The symptoms described by this patient put his alcohol use in the category of substance dependency, according to the DSM-5, a more severe form of abuse than substance addiction. The criteria for this condition are: tolerance, withdrawal, unintentional excesses in consumption, persistent desire or unsuccessful efforts to reduce or control substance use. A great deal of time is spent to get, use, or recover from the substance. Interference with social life. The substance use is continued despite knowledge problems caused by use. Prolonged alcohol abuse can result in a severe deficiency in what vitamin? A. Vitamin C. B. Thiamine, B1. C. Niacin, B3. D. Folate. The answer is B. Thiamine, B1. Prolonged alcohol abuse can result in a severe deficiency in thiamine, or vitamin B1 by reducing dietary thiamine intake, impairing gastrointestinal absorption of thiamine, and causing impaired thiamine utilization in cells. Note that individuals who partake in prolonged alcohol abuse may have various other dietary deficiencies. Prolonged alcohol abuse can result in a severe deficiency in what vitamin? A. Vitamin C. B. Thiamine, B1. C. Niacin, B3. D. Folate. The answer is A. Delirium tremens. Delirium tremens, DT, is a rapid onset of confusion seen during alcohol withdrawal. The symptoms of DT include altered mental status, autonomic instability, and even seizures. DT is also characterized by hallucinations such as the sensation of something crawling on the patient. DT is the most severe consequence of withdrawal and can be fatal if untreated. The client in the termination phase of the nurse-client relationship is being very confrontational. How should the nurse interpret this behavior? A. The patient should be admitted to the hospital. B. This behavior is common for a client in the termination phase. C. The nurse has done something to offend the client. D. The treatment should revisit the working phase. The answer is B. This behavior is common for a client in the termination phase. Confrontational behavior is very common for a client in the termination phase. The nurse should not assume that she offended the client, and further action in terms of therapy should not be addressed until completing the termination phase. The nurse is in the orientation phase of the nurse-client relationship where the client has been sexually assaulted. During this phase, the nurse should: A. Explore personal ideas, stereotypes, and biases that might affect the nurse-client relationship. B. Identify themes of patterns of patient behavior and possible coping mechanisms. C. Establish acceptance, trust, and boundaries. D. Actively listen to the client express his thoughts and feelings. The answer is C. Establish acceptance, trust, and boundaries. During the orientation phase, the nurse should establish acceptance, trust, and boundaries with the client, which will be built upon in later phases.